Kinetic Edge Physical Therapy, transforming lives and restoring hope through movement. Welcome to the Little League Safety Training. I'm Carol Kelderman from Kinetic Edge Physical Therapy. Our team of physical therapists, occupational therapists, and athletic trainers are your local experts in orthopedic and sports injury prevention and management. Today we're going to go over some prevention and treatment that you as coaches will find helpful as you take the field with your young athletes. We'll cover acute or those one-time episodes that happen. Unfortunately, we can't prevent all of them. We'll cover some of the warm-up and conditioning things and things to help prevent some of the repetitive or chronic issues as well. So the first thing we'll look at is acute injuries. You usually are given some kind of a kit to take out onto the practice field and with you during games. There'll be some different things in there if you want to look over this list and see if there's anything additional you might want to add. This has been compiled by athletic trainers who have kind of been down this road before, and some things that are helpful to have in there. So you can look over that list and maybe supplement those kits if you see things that you would like to have. Some of the things we see the most often are sprains and strains, those sorts of things that happen. We'd all agree that proper warm-up is one step to injury prevention, and there are a number of different types of things that you can do. Stretching-wise, you can stretch statically or dynamically. Static is kind of that holding, long hold stretch to the point of tension. Dynamic is more integrated movements, typically incorporating multiple muscle groups, functional movement patterns. Static stretching does have its place, can be used to address restricted flexibility in specific areas as needed, but it really hasn't been shown to reduce injury rate. In contrast, a dynamic stretch and warm-up has been shown to be superior as it works muscles in groups as they are used during the sport. Dynamic stretching during warm-ups is an effective way to prepare for agility performance, increases body temperature, elongates the muscles, stimulates the nervous system, so it enhances their coordination and their motor ability by revving up that nervous system. So benefits are particularly important for younger athletes who are still learning their bodies. It also prepares their mind for the practice or the game ahead. So with that in mind, let's look at playing ball. Whether it's running, jumping, diving for a catch, batting, pitching, the athlete uses their entire body. From the ground up, kind of this loading then exploding, we call this the kinetic or movement chain. It's important to prepare the whole body for the task. So throwing and batting, they're not just shoulder motions, they're total body movements that start all the way from the ankle, as you can kind of see here in these pictures. The power of the throw actually comes from loading the hips, not specifically from the shoulder, then exploding and reloading, unloading phases. Each of those phases is critical for power and for control. All right, so how do we prevent overuse type issues? Overuse and fatigue are the number one factors that we see, especially with our throwers, our throwing athletes, especially the pitchers. So compared to their healthy teammates, these athletes, these adolescent pitchers that end up having to have shoulder and elbow surgery, they were 36 times more likely to have routinely pitched through arm fatigue. So one of the big things that we can help minimize is the number of pitches and the amount of stress they have on their shoulder, elbow, that area. So as coaches, what can you do? The first thing you can do is, proper conditioning, good dynamic stretching, running, easy gradual throwing, those kinds of things to kind of ease them into what they're doing. Second thing, pitching volume, kind of monitoring the pitching volume. Something that not everybody thinks about is that pitcher-catcher dual role. So at any level, a pitcher should really not also be the catcher for the team. That combination of these two positions results in far more throwing than is required in any other position. Pitchers who also played catcher were 3 times more likely to suffer a major arm injury than pitchers who did not also play catcher. Avoid pitching on multiple teams with overlapping seasons. Don't play year-round. Those two things kind of go together. There's an increased risk, especially for pitchers that play greater than 8 months per year. Single sport, specifically in this case, baseball or softball specialization, especially for pitchers. When we see that happen, it's often because players really enjoy the sport, they want to improve their skill, make themselves more competitive. However, focusing on just that year-round can increase the risk of injuries. Study of professional baseball players demonstrated that the players who specialized solely in baseball prior to high school actually had higher rates of injury. It's been recommended that single sport specialization be delayed at least until high school and preferably until college. Playing multiple sports has great just athletic advantage because of the multiple types of movements that they get used to being able to do. However, if baseball or softball is something that the athlete wants to do long term, maintaining baseball specific strength and conditioning in the off season is definitely recommended. So maintaining shoulder range of motion, as well as strength and endurance of the muscles around the shoulder blade area and the core is especially recommended. Then don't pitch on consecutive days and adhere to pitch count guidelines. Those things are also kind of volume related recommendations, and Little League has their pitch count rules. We'll see that in the next slide. And if those change over time, littleleague.org should have those updates. Okay, then age appropriate pitching. Mastering the fastball first, then the changeup before considering breaking pitches. Emphasizing control, accuracy, and good mechanics. Save the radar gun for when they're older. Not every pitch needs to be full effort. Radar guns provide incentive to overthrow in an attempt to light up the radar gun, make a favorable impression. Injuries are more likely when there's more stress placed on the body, so higher velocity throws place more stress on the shoulder and elbow, and pitchers who throw with greater velocity than other players their age should particularly watch these guidelines and be careful. It's important that all players, especially those young players, focus on proper mechanics and throwing technique before trying to increase their velocity. Ligaments in the arm actually have a red line that can be exceeded, especially when not well matched by body control and mechanics. So, and then the last one seems like a no-brainer, but it isn't always. Don't pitch with elbow or shoulder pain. So encourage your kids to communicate regularly about how their arm is feeling and if there is any pain. Okay, here's just some of those pitch count and rest day recommendations. And then I would encourage you to just take 4 minutes to watch this video.
We really need parents and the student athletes in most cases to understand their role in this.
We've made the following recommendations from the studies that we've done at the American Sports Medicine Institute to help prevent these injuries now that we know the risk factors in youth baseball. And the number one thing that we recommend as far as prevention is to try to prevent fatigue.
The research has shown that kids who pitch more than 100 innings in competition during a calendar year, whether that's for one team or multiple teams, are much more likely to have a serious elbow or shoulder injury leading to surgery than those who don't. If we look into it at a game-by-game basis, the research has shown that pitch counts is the ideal way to keep track and monitor how much people are pitching and therefore their risk of getting hurt.
We also recommend, of course, that they not play in one league at a time, and they don't play year-round baseball.
There's a lot of focus and pressure to force people into, a square peg in a square hole, which is you're a baseball player, you got to pick baseball, and that's all you concentrate on 12 months a year. What the orthopedic world is telling us is that is unhealthy.
the next most important thing is to learn proper mechanics. Now you got to remember that young kids are in a growing situation, and they don't have good neuromuscular control. They don't have the balance as of an adult athlete.
Fastballs, changeups, curveballs, and even sliders have been compared in the biomechanical studies. The overall conclusion is that the fastball, when done right, is stressful on the pitcher, but is necessary and is acceptable. And the changeup is the single particularly safest pitch to throw.
Now, there's always controversy about the curveball. I still, in my personal belief, is that we got enough injury factors and enough risk factors to not recommend throwing a curveball as a young pitcher. That means don't throw a curveball until you shave.
Everybody wants to quantify what they do. You have batting averages, you have how many home runs somebody hits, and then on the pitching side of it, one of the aspects is, hey, how hard can you throw? We're going to wind up in a situation where there's many people that might have been potential major league caliber personnel that get removed altogether because they blew a shoulder out because of damage that they did trying to max out and impress somebody in a small environment before they were fully developed.
One of the things that pitchers can do is not throw every pitch at full effort. And again, if you're pitching for the radar gun, you're going to pitch every pitch at full effort.
The other thing, of course, is listen to these young kids. Sometimes the only person they will complain to about having a painful elbow or a painful shoulder is at home to their mother.
Anytime someone has pain, that is a go-to for me to just say, hey, it's time to take a step back, let's reevaluate, let's see the doctors, maybe we need to do a diagnostic test, and take our time with this. Because I do know, and the research shows, if we try and push someone through this, they're at way higher risk for an injury, or a complete tear, or rupture of the ligament.
And they should not play, pitch, or throw with a sore elbow or a sore shoulder. I've even heard stories anecdotally now about parents giving young baseball pitchers some type of pain relief medication prior to a baseball game because his elbow was sore so he could pitch. You just cannot do that. Common sense, again, rules the game.
Competition, the will to win, the pressure to perform can at times override the decision-making process. And the most important thing for amateurs to do is to be in a competitive situation and have fun, but also protect themselves.
Hello, my name is Heather Pilcher, and I'm an athletic trainer and a physical therapist assistant at Kinetic Physical Therapy in Oskaloosa, Iowa. Today I'm going to talk briefly on how to use an AED and where it's located at the Lacey Complex. I'm going to talk about concussions, signs, symptoms, and what to do if you suspect one in an athlete, and also heat illness. Our AED at the Lacey Complex is located on the left-hand side of the concession stand. If you're looking at the concession stand, it will be around the corner to the left on the same wall as the door to go into the field house. Some basic instructions would be to obviously, if someone collapses and does not have a pulse or a heartbeat, to please call 911 first. You'll also have someone go to get the AED, where you'll turn it on and you'll follow the voice prompts. Most of them are very simple to use and will give you clear, concise instructions on how to use them. So on the screen or the slide, I have some basic things like remove the clothing, where to put the patches, how to plug in the AED. But again, the AED itself will tell you how to use it and what to do. The biggest thing I need to say about this is 911 should have already been called and should be on the way. Next, we'll move on to concussions. As you can see on the slide, there are several signs and symptoms of concussions. Most of us should be pretty familiar with these, and most of us have probably had a concussion at one time or another. Some of us old timers call it getting our bell rung, but it's one and of the same. So, as you can see, the most prominent symptom would be headache with 71%, balance problems, dizziness, nausea. So if you have an athlete that gets hit in the head with a ball, collides with another player, or maybe slides into a base and gets knocked around a little, and they are exhibiting any of these signs and symptoms, you have to pull them per Iowa law, per national law. So that is, when in doubt, sit them out. So that follows us into how we handle them. So after a suspected concussion, no athlete of any age can return to practice or a game on the same day. They need to be looked at by a licensed healthcare provider, which those in the state of Iowa are listed below. That is something we do offer here at Kinetic Edge Physical Therapy. So you can have someone come get checked out by us for free, and we can do that for you, or they can make an appointment with their normal primary care physician also. After receiving medical clearance by a licensed healthcare provider, then they are allowed to go back into what we call a return to play protocol. So starting out slow and, going back to practice, and as long as there's no symptom return, then they can go back into play. But again, they have to be cleared by a medical professional to do that. To get a hold of us, you can give us a call at 676-3535, and we would be happy to clear or even just take the initial look at any of your athletes that you suspect to have a concussion. Now moving on to heat illness. We're playing ball in May, June, July, where it can be very, very warm here in Iowa. And a lot of times our kids who are still in school have not gotten acclimated to Iowa weather yet. So it usually starts out fairly mild with maybe some cramping, diarrhea, headache, dizziness, and that is just a mild illness. And the core temperature is less than 104. It's not a medical emergency. You'll move them to the shade, get them some Gatorade, get them just rest, and just have them feel better. They'll start feeling better after you get some fluids in them and they cool down. What is a medical emergency would be a heat stroke, and that is when you need to call 911. This person is usually lethargic. They might be vomiting. Their heartbeat is irregular. They're probably confused. I cannot stress enough that if you feel like a person is going into this, they need to be in cool water, in as cool place as you can get. They need to be stripped down to underwear, and you need to be cooling them in any way you can. And again, 911 should be called because this is a medical emergency. On the next slide, this is from the Corey Stringer Institute for Exertional Heat Illness. These are the people on this slide who are more likely to get some type of heat illness. High BMI, low fitness level, they haven't drank all day because they sat in school. They already might have some type of tummy bug, they might already have some dizziness, diarrhea or vomiting, and then they go out and try to practice, and high temperature, humidity, and they go down pretty quick. So obviously we don't punish without water breaks anymore, so we're giving them lots of fluid, even pushing Gatorade at the beginning when it starts to get real hot out, and these kids aren't used to being outside in the heat. So that's some basic information. Obviously we have a lot more, so if anyone has any questions on any of this, please call either Carol or I at 641-676-3535, or you can email us at carolk@kineticedgept.com or heatherp@kineticedgept.com. We'd love to talk to you more about any of the stuff that we briefly touched on. We'd also like to be your local sports rehab experts. So if you have any questions or any concerns with a player, please refer them over to us. We do free injury screens on all local athletes, and that can be anywhere from a knee injury to a shoulder injury, or like I said, heat illness, concussion, or any of the things that Carol spoke about before me. So we appreciate your time, and please let us know if you have any questions. Thanks. Bye-bye.